Turning now to Health Watch this evening, traditional surgery for a severe fracture to an ankle can leave patients laid up for months, leaving some with permanent problems walking. As Shelley Bota tells us, there's now a minimally invasive operation for surgery that can help patients to recover faster.
Josh Toneys suffered a life-changing injury that could have left him disabled, but a minimally invasive surgery got him back on his feet quicker and with a better recovery outlook. Josh Toneys does not take walking for granted.
I'm able to walk. I mean, on a normal day, I'm walking 6 to 7 miles.
In January, the construction worker was on scaffolding 8 feet up when suddenly
Lost my balance and fell onto concrete.
Josh landed on his heel, then tried to stand.
I almost felt like there was pieces inside of the foot. And I immediately fell back down.
Josh turned to orthopedic surgeon Dr. Mike Schnaubelt at Aurora BayCare Medical Center.
Josh had a severe fracture of his calcaneus, which is the heel bone.
Dr. Schnaubelt says the outlook for recovery isn't good for this type of injury.
There's some folks that just can't walk for very long or stand for very long.
He said, construction is no longer in your future.
And for a father of 2 and runner,
I was terrified. It was one of the scariest moments of my life.
Dr. Schnaubelt performed surgery using a minimally invasive incision technique, which is not widely used in our area.
Which is basically just a more limited incision right below the lateral malleolus, which is the bump on the outside part of the ankle.
The traditional approach leaves a larger cut all the way around the ankle to the bone and is more invasive.
Very disruptive approach to the anatomy. And there are significant issues with healing. There's about a 40% complication rate with that type of approach.
Because Josh's incision is smaller, it heals faster.
It's a limited incision, limited dissection, and I think that's what enabled him to do as well as he has.
It also uses less hardware. Big plates are replaced with screws.
And so the bone does tend to heal quicker.
Josh's recovery has been on the fast track.
Josh is doing fantastic right now. He's about as well recovered as I've seen for this type of procedure.
While he won't be a runner again, Josh is looking forward to being active with his kids.
Playing with my kids, which is the most important to me, taking walks with them.
Josh is getting out of construction and going back to managing a lodging facility. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.